It's no secret that the drug abuse issue has continued to rise in the United States. We know for sure that specifically the opioid issue has become essentially a epidemic in the US. And part of that is primarily attributed to prescription drugs, specifically prescribed medications that are being abused. And that has kind of changed the tone in which we address the drug abuse issue in the US.
Yeah.
From our former, you want to talk about, well, let's get right into it. She ready. Let's talk about that change. Come on, Dr. Joe. Let's talk about it. What has changed? What have you noticed?
Well, instead of it being, oh my God, look at that, they're over there and they're using drugs, it's more like, oh my goodness, it's a problem. We now need to treat it. People need help. They can't
It's a
help
disease.
themselves.
Yeah.
It is a disease, right? Which is a good thing because yes, we know addiction is a disease. However, it wasn't always perceived that way. And sometimes the circumstances of who had a disease and who did not made it very questionable as to what the intention was. I'm gonna leave it like that.
I don't
Yeah,
think
I
you need
agree.
to leave it at all. I think we actually do need to talk about it because it's part of what has caused this certain turnaround and increase in resources. But there's certain drug issues that continue to be disproportionately an issue in other communities. So let's talk about that part. What were you going to say, midwife?
I mean, I agree with her. I think that, when you're talking about street drugs, everybody wants to criminalize that person. And when you're talking about prescribed drugs, drugs are drugs, whoever's dealing them to you. And if you're using them and abusing them not the way you're supposed to, it's a drug. I mean, in the settings where I've worked, there is a lot of marijuana use. I always thought, depending on how they're using it, why they're using it, um, I would talk to women about the risks of it, especially marijuana, because there's so much new research coming out about it, right? About we didn't have a lot of good studies before, and so it was a little bit nebulous. And I think that we need to be careful and think about why we're doing what we're doing when we counsel women, when we say we're going to report women, when we say we put it on their charts, for example, as providers, and what the sequelae of those actions are to mom and baby and the family unit. So that's what I always think about.
Yeah, it's really, really layered because we are mandated reporters. The question is, should we really be criminalizing drug abuse for women who are pregnant? And how really should we look at the disease process of addiction to drugs and pregnancy? It's quite a very complicated situation. But specifically talking to the communities of color, one, it's a very touchy topic because for example, marijuana for quite some time has been used to pack the jail system with Black and Brown men and women. And also, when we look at the legality of or the issues when it comes to custody and moms, our babies have been primarily taken from us.
Yeah,
The system is very quick to remove Black and Brown babies. And
yeah.
so it makes it very complex for a mom of color in particular to reach out for help because she's trying to, even if she wants help, because she's, either already had a child taken away from her or is very familiar with the process and knows that that's basically the end result of a lot of our stories. Um, and trying,
Or
yeah.
or like, for example, if somebody was using marijuana, and I say marijuana because we're in California, so that's a lot. It's legalized here, but somebody who was using marijuana recreationally or medicinally before they knew they were pregnant. So then they divulge that and they say they're pregnant. And then kind of the trajectory from there on out, they're tested every trimester. You're still kind of looked at as like, oh, she was a drug user, and they test you and treat you in a way that maybe they weren't treating somebody who didn't divulge that, right? They're not going to be testing you. Some places do it standard, whatever. Some people make it their standard,
Mhm.
and others only if there are risk factors that they identify.
Yeah, 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 definitely. There is definitely no hard requirement to test women for drugs during their pregnancy. And certainly, if you are testing them for drugs, it really should be coming from the intention of wanting to help someone. But as you mentioned, oftentimes it's criminalized disproportionately to our minority communities. And so it makes it a very challenging. But definitely an American College of OBGYN does not require testing and specifically, but some type of screening, which doesn't necessarily have to be actual testing, actual drug testing. So yeah, how do we approach this topic? How do we approach the topic of addiction, and what kind of support system should we be providing for these women? Like, what would it ideally look like if we were truly intently trying to help people who are struggling with drug abuse?
It sounds like it, it needs to be a part of their care plan or discharge plan. So, and I don't know if if it's about marijuana use. I'm wondering, what if it's alcohol use that causes fetal alcohol syndrome? What if it's heroin use and your child is born addicted in utero? So, and I think it's a compounded issue as well. To your point, Dr. T, we have to deal with not being believed when we're in pain. And then the whole thing with, addiction, and you might not even be addicted. You might have had a one-time use and you just happen to get tested. So I think it's a compounded issue, but I think a point that we could do is, if it is an issue, what is their history? Is it just like an isolated incident, or is it repetitive behavior? Like, see what their history might be and incorporate some sort of counseling, therapy, rehab, inpatient or outpatient, as a part of their treatment plan. And maybe we can start it that way. But the other thing is, it might not be a criminal issue, but it also could be a child welfare issue, because it could be neglect. If your child is born with FAS in utero, 9 times out of 10, when you have that baby, and I don't know if the law you're talking about in California incorporates alcohol or not, but if it does, I'm wondering, if she is positive for, fetal alcohol syndrome, what happens then? So it's, what kind of drug they mean, or is it an isolated incident, or a repetitive pattern of behavior? So, but I think incorporate some sort of treatment, incorporating rehab in a treatment plan or their discharge planning, and then monitoring that maybe is a start.
Yeah, I mean, you definitely raised a good point, and that's part of why this topic is so touchy, because there are outcomes, bad outcomes or poor obstetrical outcomes associated with drug use and drug abuse. And so it is concerning when someone does have an addiction. So help us to understand, what is addiction like? Why is addiction so hard for people to beat? Because a lot of people kind of always seem to, I would definitely say, I do know women, I can't specifically say what relationship, but y'all could read between the lines, and do know women who struggle with drug abuse of various kinds, whether it's amphetamine, narcotics, and they oftentimes have family members who will say to them, why don't you just stop? Just stop. Help us to understand a little bit more about why people can't just stop.
For instance, with alcohol, it's deadly if you just stop. It could be deadly once you have, like when I was working in a jail in LA, people had to be monitored, and they had to be, they had to wean them off. They had to have Librium, all these other things. Some of these withdrawal symptoms or some of these detoxes can be deadly. I mean, I know you've heard of some people who tried to quit cold turkey, but alcohol enters your bloodstream, if I'm not mistaken. So doctors, correct me if I'm wrong, but that's, it affects your liver. And when that starts, seeping through your body and things like that, it's harder for you to just quit. I had a patient once who was an alcoholic, and we were doing like harm reduction, and he couldn't go through a whole meeting without, delirium tremors. Like he was shaking. We had to incorporate him stepping out in order for him to make it through his meeting and things like that. So again, I think it's the type of drug. But some things family needs to understand. Addiction is a compulsion. Addiction is, I'm sorry, go ahead.
No, I was agreeing. Sorry, I was agreeing. I was all right.
No, go ahead. Go ahead.
No, I was agreeing with you. I was saying right. I was like giving you an amen over here in the corner. I'm sorry.
Amen.
Yeah.
Amen.
Right. So it's like, I might have an addiction to food. Like, I don't always need to eat, and it also is stigma. Like, depending on the drug, there are a lot of stigmas with drugs. depending on what you, like we talked about already, what you look like, if it's just wine, if it's crack versus cocaine, if it's, it's a very compounded issue. So I think you have to at least analyze it or take it on a case by case basis. But I think the baseline could be like, I don't know what the baseline could be, or if there is one, depending on the kind of drug. So I do know kids have been removed for neglect when a child has been born. They may not have gone to jail, but in the words of child welfare, a kid has been removed from the parent due to neglect in utero.
I know that, yeah, like I know that as a provider, I always hesitated because I knew that, especially, so for example, no, we don't hear that much talk about tobacco, right? People smoke all the time, and you don't ever hear anybody talking about, oh, she's a smoker, we need to test her, maybe she's harming her baby, even though we know all the harms of smoking while pregnant and smoking around babies, the dangers of secondhand smoke. You don't hear as much about the alcohol. You're right. Fetal alcohol syndrome causes a placenta. I mean, we know all of these things, but the focus has always been on the illegal drugs. And so I know that now, for example, that marijuana is legal in California. I always struggle because I know, for example, for my Black and brown mom, that if I say she is using marijuana or we test her and she comes positive, then the social workers will get involved and they'll take their children. And so I struggle because in order, criminalizing in the sense of going to jail for using drugs versus criminalizing and saying that you're going to be a bad parent because you use recreational marijuana is a difficult pill to swallow, especially because we know, like she said, that it's layered and we know how addiction works. And I think there's a difference between recreational drug use, depending on what we're talking about, versus addiction. Addiction is, I think, for a lot of addicts, when we think of addicts, I think there's certain behaviors and things that we see and that are clear. When a mom comes in and she's in labor and she's a drug addict, most of the time, because she's maybe high on what she was actually addicted to when she comes in labor. There's certain behaviors, there's certain things that in those instances, you're like, this person needs help. This person is going to need social work to step in because we for sure have to make sure that this person and baby and family are safe. I think it's a little bit harder when there are gray areas, when you're like, I'm not necessarily sure that you smoking weed because you have terrible nausea and vomiting in pregnancy, and medical marijuana is amazing for that. That's why they give it to cancer patients. I'm not sure if you're using that means that you're going to be a danger to your child. So there are so many like nuances in it that makes you kind of like, what do we do with this? And like you said, Dr. T, what is the best approach to address just drug use or alcohol use in pregnancy?
Yeah, it's hard because then, we're also dealing with the rise in deaths. Just in 2019, we had over 700,000 deaths related to drug abuse and specifically drug overdose. And so it's potentially deadly. But you're right, in various states, marijuana is now legalized. And it's not unusual for a woman to not really know she's pregnant while she's still socially using marijuana or medicinally using marijuana because she has headaches, because she has some type of underlying chronic pain issue that she's medicated with it. And then, like how many, we talk about unplanned pregnancies all the time. So it's not unusual to have a positive marijuana test, especially in certain states. But finding that balance between the two is really, really challenging. I would definitely say one of the key things for moms who test positive, who are clearly not addicted and maybe socially using like marijuana, for example, is to just prove that you are stopped, prove that you're no longer using by having random repeat drug tests just to demonstrate that it continues to be negative. But then also, I think practitioners, we sometimes don't really pay attention to the nuances of even the laboratory tests, because how many times does certain things react with amphetamines? And usually we oftentimes don't pay attention to the fact that we're doing screening tests and not diagnostic tests. So making sure that if something screens positive, that you confirm it with a diagnostic test, because I've had some moms who have run into issues because they tested positive for amphetamine, but they were on a blood pressure medication that will cross-react with that test. And no one took the time to really do a confirmatory test to make sure that she was truly either positive or negative. So I definitely think there are lots of nuances, but the fact that we're continuing to see a rise in the deaths related to drug overdose, I think does warrant this conversation, does warrant us to come up with a process or approach that works and is sensitive to the implicit biases that exist in our system. Yeah, and
So oh, sorry.
no, you're fine. You're fine.
I would say, in my just humble opinion, when the crack epidemic happened, if we would have addressed the crack epidemic in the 80s and put certain policies and stuff in place, we would know how to deal with the epidemic now, the opioid epidemic. So the fact that it's an epidemic now, but the vocabulary is even different. It's an epidemic, but then in the 80s with the crack epidemic, it's a war on drugs, aka a war on Black people. So we got to be like, the vocabulary is very, very different, and subjective as well. So I believe, like, okay, you can't cry with spilled milk, but I believe firmly if we handled the epidemic when it affected Black folks in the 80s with the crack epidemic, I think we'll be a little farther ahead with addressing addiction. And for Black folks in the 80s, it was, oh, you need jail. Now, because the skin tone has changed, you need support and you need rehab. So you also need to be very, very cognizant of the vocabulary associated with those, those groups of folks, like Black folks and then other folks. So
Karen, you are shaking your head. She can't. Sorry, Olivia.
No, go ahead.
Karen is shaking her head.
I'm shaking my head because the way that she put that was so true. And being in that area when that crack epidemic happened and stuff, and I know personally on hand how many people in my family that it affected. And some of us in the system and stuff, whether we was with a grandma or great auntie or whomever that could take us, they took us. But the ones that wasn't able to take us, ones that didn't have no close family members, they was actually put in foster care with a big home and everything. And that's sad. A lot of them got through it. A lot of them didn't. And some of them repeated the cycle as they got older now. So I know some people of that in real life. So that is crazy. Yeah.
Yeah, Olivia, you were going to say something also? You're so right, Karen.
Yeah, I agree with you, Karen. I was just going to say that I think a good way maybe to approach it would be a team approach. So something that I always hoped that we would have that was not a part of the treatment plan was that for example, coming together with the social workers and all the people who would be involved anytime there was worry or concern about drug use or addiction in pregnancy, so that the provider who was taking care of them the whole time, the social worker, maybe the delivering provider, that the people who were going to be involved in postpartum and all of these things would come together to create a plan that specifically addresses the issue for this specific person and their family, so that there wouldn't be just this blanket approach. And therefore the providers who knew them best could give input and say, listen, based on what I saw these last 10 months of pregnancy, I think this is why they were using, or I don't think that this is actually going to be an issue, or I do recommend that perhaps the baby, just having this conversation, and then the social worker could tell us what the laws are and why these steps need to happen, but so that the patient and the family and the babies all have support from everybody on their team, so that it's like a clearer picture and a better approach versus creating policies and laws that are very gray, very blanketed, and tend to do a lot of harm. When the idea is, like you said, we're trying to do good, right? The idea is you're trying to protect a woman, you're trying to protect the baby. But when they're not personalized to the actual person and situation, a lot of the times they just create a lot of harm and barriers.
You're reminding me of a conversation I overheard, not overheard, I was watching a conversation briefly earlier today, where it was two African-American doctors that were saying they're always hesitant when they hear policies and laws because they automatically know what that means for Black and brown people. that somehow we're going to be ultimately punished. That it's always some way to implicitly um, uh, punish the Black and Brown communities for something that is much more widespread. So it's you're right. I think when we start talking about laws and policies, it makes us a little bit like we all kind of sit up a little bit because it makes us uncomfortable, right? And to Karen's point, yeah, I was raised in Brooklyn during the drug war years, and I literally saw it. I witnessed those years of the drug wars and all the violence that circumvented it. It was not an easy life. It was not an easy experience to see, literally see. Like it was not unusual to see drug sales in front of my school on the way home from school. I mean, it was my everyday. And I think also maybe training clinicians, because I don't know that the average clinician is well trained enough to deal with drug addiction and drug abuse, because it can be, like family members will tell you, it can be quite frustrating to see someone come in, they have that moment of clarity and they're like, okay, yeah, I'm going to get off. Understand. And then the next time they come back, they're like, yeah, I just used again. And just really understanding the science of that disease, and training the medical profession to be empathetic, so that we're able to, I always mix up sympathetic and empathetic, but you know what I mean. To always make sure that to always make sure that we are able to deal with the sensitivity of those situations, because it's hard. It's hard. Like I can tell you, for some of the people I know that are struggling with it, who are pregnant, it breaks my heart every single time they come in and they're used again or used again. And I felt like we broke that light, that we made that break the last time. And it's a part of the disease, and the disease is more than the individual. It certainly affects everyone involved. Yeah.
And I think, who's Karen? Go ahead, babe.
I wanted just to go back, piggyback on what Olivia said about how the practitioner and the parent and the child, how working together and stuff. I could tell you personally on hand that I knew somebody that they did get their child taken away from for, they're in their 20s now, but the child is in their 20s now, but when they was little, their parents they got taken away from their parents from marijuana use. So the mom had to go through several different classes to get her child back. Mm-hmm. However, once she stopped and got her child back, probably within that next month, she was back doing what she was doing. So I'm all like, how long do, first, my question is, how long do supervision is still on the parent with a social worker after she did what she, have done to get the classes to get their kid back? Like, how long do that last and stuff? Because obviously, it didn't last that long for that parent, because they was all like, all right, I'm gonna go back to my old habits, my old ways, and do it the way I want. Nobody can't tell me how.
This is the thing with that, Karen, is it takes as long as it takes for the parent to complete the treatment plan. Like if they're in FCC, or that's Franklin County Children's Services, if they're in Children's Services in whichever state that you're in, however long it takes them to complete that treatment plan as a part of getting their kid back, that's how long it takes. And then you can have different types of monitoring. So they may go down to from weekly to bi-weekly to monthly, just depending. And so again, like Dr. Moore said, if this is the other thing that I had when I first started social work and learning, if a parent is using drugs and that kid's not neglected, the home is clean and things like that, if the child is not in danger, our job is to be least restrictive. So if it's more traumatic removing the kid than leaving the kid in a home, you're going to be least restrictive and you're going to leave that child in the home, because it's more traumatic removing that child. So, and it also depends on, again, if you're leaving your kid overnight, but if let's say your kid is in a home, you go outside, you use, your kid is not exposed to it, it's nothing in the house. It's very compounded. It's very, very different depending on, state to state. In the 2 states that the 3 states that I worked in or trained in, It's like, for instance, not illegal to be homeless. Like, you can be homeless with your kids. It might not be looked at, in a positive light, but you could be homeless. So if your kid is not directly affected by your drug use, you got to take that into consideration. Like, that's what Children's Services takes into consideration. However, if your child is with you while you shoot up, and like you're in the car, like in Ohio, the opiate addiction is huge in Ohio. Like, the morgues were overfilling. They were finding kids in the cars with their moms and their dads who have OD. Now that's different. You understand what I'm saying? The kid is directly exposed and in danger. So child endangerment and neglect versus not exposing your kids to any of it, and you've maintained a certain lifestyle for your child, that's also needs to be taken into consideration. That's the training that I've had. So,
Gotcha.
in regards to child welfare.
It's
But
really,
if
really
it's 3
complex.
years to complete that treatment plan, it's going to take 3 years to for us to get out of your life. So it's on you if you have a child welfare treatment plan. So.
Wow. And also keeping in mind as well. I'm sorry, Dr. Joe, were you about to say something?
Well, I was just kind of pondering a couple of things, and one of them was that, like even with ACOG says that you can have up to 9 alcoholic drinks a week during pregnancy. I think that was the last thing I heard. But alcohol has a bit of respectability to it. Though we do know about fetal alcohol syndrome, alcohol has a bit of respectability to it. At what point in time are we going to have the respectability of marijuana? When are they going to start doing experiments to see how much marijuana is too much for the pregnant moms? And then, honestly, I expect to see any of the other things come down the line. I mean, because if we're looking to see that it's bad, yes, we know they're going to cause certain things in babies. We know that there are different things that can happen, birth weight being an issue and everything else like that. But there's going to be the research, prayerfully, that comes down the line and says, okay, what is too much? Then at least you have more information to give.
Yeah, I think ACOG still takes the stand of no alcohol during pregnancy. But to your point, Dr. Joe, it's it's an evolving science, right? Like, I think now that it's legalized, because before, who would volunteer for any type of experiment or even admit that they were using it, because they would be criminalized.
Right.
And now that we have states where it's legal but not really decriminalized, that's a whole other topic, but you guys know what I'm talking about, right?
Like, you better talk about it.
But people are still in jail. People are still in jail. Okay. When is that going to change? When are we going to return those fathers to their homes, to the homes of their children? Because that's a part of the concern with this whole epidemic, if we want to call it that.
The thing with that, Dr. Moore, is once you're in jail, like, you may have, let's just say you may have been in jail, but you have to survive in jail. So if you went in for marijuana use and then you got into some fights, or you did what you had to do to survive. So let's say these laws come around and they're removing people for jail for marijuana use. Now you have women and men now have multiple disciplinary actions on their record. So their time is extended. It may have started with marijuana, but the way you survive in jail, it's a whole different set of rules in jail and laws and stuff in jail. So I think that's another compounded issue is once you get to jail, the things that happen to you while you are there, you are under you no longer govern your own damn body. If you don't do what somebody says, they'll write you up, you'll get a dean, you'll go back to the board, and they'll add more time to you. So I think that's also another compounded issue that needs to be addressed. Like, it may have started, but they never should have been in there anyway because of the, marijuana use. But because the way you survive in jail, now those charges are pending. So
it's so layered, because then you've changed behaviors, right? Because people now have acquired new behaviors after 5-10 years of being in jail. Now you criminalize me, right? I went in and I was a law-abiding citizen, or maybe not completely law-abiding because I was carrying marijuana, but otherwise not a violent citizen. And now I had to survive in jail. And now that's all I know, because that's all I've known for the past 5 to 10 years, and some of them longer. So it's just, it's so many things that we need to do to fix the system. But I definitely think, and then also to the other point I was going to make was to something Olivia said that triggered a thought, which was, yeah, and then these women are dealing with self-esteem issues. Like it's hard enough being a mom from what all of y'all have shared, and then you layer with that something that people feel justified in being judgmental to you about, right? Because of all these negative outcomes and potential outcomes. And so you have moms who are at risk for the postpartum depression, anxiety issues, compounded with that. And we know that, I think it's somewhere, I don't want to quote me, but I think it's like 8.5 million people have a combination of mental health disorder with drug, in addition to their drug substance abuse. So it's very, very layered, very compound. And I would like to see a system that exists with what Olivia had described, a system where it's really supportive, where people don't feel judged, that they feel that, no, we're asking because we really want to help you. We want to help you have a healthy pregnancy. And that's how I approach my patients, is we want to make sure that you have a healthy pregnancy. I get your concern, but we also want you to be safe. And we will help you through the process as long as you're willing to do your part as well. But understand that we're coming from a place of caring for you and not judgment. But it's hard because even if they trust you as a provider, they don't trust the system.
It's a historical piece. And now I'm gonna add one more point to that, Dr. is that when you're looking at drug addiction, you are looking at the result or the outcome of some sort of trauma that has manifested in this person's life. So we always treat the result. What you have to do, I remember when we first started, you talked about incorporating things at the beginning of your treatment plan, when you first find out you're pregnant. Understanding like their, doing an assessment to understand their history. So I think like we oftentimes start at the result into what we see, which is the drug addiction. However, we don't understand how did you get there. We judge you based on what we see in that drug and the stigma with that. However, what is the underlying trauma or the compounded trauma that you have experienced that led to the drug use? Now, if you address that from Jump Street, that can help ease, and then it lets them know it's like, oh, okay, it helps you engage and build rapport with your client. It's like, okay, like you're really trying to hear me, like you're really trying to hear me. And when you let them know, like, listen, I'm not here to judge you. I'm just here to understand, not, like, how did you get to this place? Like, what happened to you? Using certain type of vocabulary, like what you do to get here? Like, no, not that. Like, what happened to you?
I always ask Chastity, when I find out that somebody's using drugs and they're pregnant, my first question is, can I ask why? What is it helping you with in your life? That's always my question. Always. Like, if there's a reason you're doing it, what's the reason? And I always state it like that. What is it helping you with in your life? Always.
What are you trying to block out from it? You know what I mean? So absolutely.
And co-sign that, because sometimes even with the marijuana group, it's an opportunity to treat something that they're dealing with, right? So something medically as well. So you have the historical factors, you have the medical factors, so many reasons why people use or end up using drugs to medicate something. You are always medicating something. The question is, what is that issue that needs medicating? And so I completely agree with you guys. I completely like the whole process of making sure that we get to the root of what the issue is, so that people feel heard. I love that point, Chastity. Love that point. So you guys, that is it for today. Clearly, I feel like we can go so much deeper with this topic. There's so many places we didn't touch, but we're just going to give you a little appetizer. So Chastity, after laying down that point, let us know how we can follow you. Where can we find you on social media?
Miss MZ._Chaz, CHAZ. That's wrong. It's MS._CHAZ. I had a Trisha moment and Karen moment. Sorry.
We haven't been on here for a minute. I got you. All right, Olivia, where can they find you?
You can find me on Instagram at This American Midwife.
And come on, Dr. Trista, where can they find you?
TristaJob.dpt on Instagram.
Awesome, awesome. And with a fabulous knot, Karen, where can they find you?
They can find me at What a Touch on IG.
Awesome, awesome. And I am Dr. T, the hand behind the handle of Healthy Bump Club. You can find us at our new home at healthybump.club. See you there and see you at our next episode. See you guys. Bye.